Good afternoon, everyone. Thanks for joining us today for our webinar. My name is Kelly Ammons, and I am the president-elect for the Colorado chapter. I want to welcome Cassie Hansen and Justin Myers. They will be discussing some third-party coverage and liability, and they are with Elevate. So welcome, Cassie and Justin. Thank you very much. And if you're on here for CPE credits, just as a reminder, making sure you need to stay on for the full 50 minutes. There will be surveys throughout this presentation, so make sure you participate in that. And then there will also be a feedback survey that you will have to participate in. And then afterwards, throughout, if you guys got questions, please put those in the chat and I will monitor those and I'll alert Justin and Cassie so they can answer those questions. And then afterwards, when we are done, this will also be recorded, so you'll get that within 72 hours. And then we will also be sending out the slide deck.
All right. So I'll kick it off. Real quick, I think go back a couple of slides, Cassie. I want to do a brief kind of little introduction of both of us. I'm the division president and COO of Elevate. I've been with Elevate since 2008. I'm an attorney based in Texas. I've been licensed since 2004 and been practicing in healthcare since that time. Started with Elevate in 2008 through an acquisition. And Cassie, I want to give you an opportunity to give your background as well.
Good afternoon, everyone. Cassie Henson. I am currently the Executive Vice President overseeing TPL operations for Elevate, but I've also been in revenue cycle management for complex claims about 18 years, and I'm also a licensed attorney. I'm located in Mississippi and was in private practice prior to that before coming into the healthcare sector. So thank you for having us today.
Yeah, thank you all for having us. We've been in this practice for a long time of third-party liability accident accounts, so we're excited to share kind of our experience and our knowledge here with you all today. If you'll skip to slide, yeah, there you go, slide 4. We're going to talk today about what is TPL. TPL is accident accounts, right? We're going to talk about automobile accidents in particular, but accident accounts, what does TPL mean? The challenges relating to accident accounts, why hospitals often struggle working these types of accounts, the fundamentals, what you need in place in order to work them effectively, a TPL program best practices, and then kind of your options of a TPL program. So we'll start here by what is TPL? What does TPL mean? TPL is third-party liability. So when your hospitals are referring to a TPL account, really that's referring to third-party liability coverage. There's other coverages, and we'll talk about that, generally associated with, accident accounts. But here we're talking about accounts. We're talking about accounts that are some type of an accident. Generally speaking, they're automobile accidents, right? But we've been working through this type of inventory for many years. We've seen all kinds of different types of accidents that are collectible in a program like this. I mean, many years ago, we had accident accounts that involved cars hitting a cow. We've had slip and falls. We've had, horse and dog bites, those types of things. Really, we're talking about anything that involves the fault of another in some type of an accident. That's what a third-party liability account is. Go to the next slide. Why is this type of inventory really challenging for us to work through? Why is it challenging for hospitals? Generally speaking, accident accounts are slow-paying accounts. They take a long time. You have your first-party coverage, which Cassie will talk about. That's relatively quick paying, but then you have your third-party liability coverage, and a lot of times that takes, a lot of discovery process, a long discovery process, and they're just kind of a slow paying inventory, which increases your AR, right? It ages your AR, it increases your AR. They're extremely labor-intensive types of accounts. So, accident accounts, you have to go out and find the insurance information. You have to work with adjusters and attorneys. There's just real specialized knowledge that you have to have in order to kind of discover that. There's specialized technology these days that you're using to go out and discover that type of coverage. And then the last part is It's challenging because you're working with a host of attorneys, adjusters, patients, and they're all really ultimately looking out for their own interests and not necessarily trying to protect the hospital's interest. If you go to slide 7, Cassie, I'll turn it over to you.
Thank you, Justin. And so as we look at those challenges, which is why we often consider TPL to be part of complex claims, for most hospitals, accident accounts are not their largest sector of accounts, unless maybe you're a trauma center. And even with those, there being a smaller pool, some hospitals may ask, why does it even matter? Why carve out these accounts? Why should you not just let these go on through your usual revenue process flow and with any other payer that may be identified? There may be a small amount of your inventory. However, there's also an opportunity whenever you're specializing in these identified accounts for multiple reasons. And the first of those is with this small amount of your AR, it is often your highest paying class of accounts. On average, collections from TPL may be above 40 to 50% of which is not typically recovered on average from any of your other health payers or any of your self-pay inventory. These are also your only available payers that may be able to pay you full charges and not just a discounted or contractual rate. And compliance. With state Medicaid and federal regulations, they usually require that if hospitals know a patient is being treated due to an accident, that those hospitals take due diligence in billing any TPL payer that's primary to Medicare and Medicaid. Because of this compliance, if it's not billed properly, you could receive a denial on those accounts, which slows down your payments and your AR, requiring additional time for your staff to rebill. And for even those self-pays, those TPL payers will pay faster when these accounts that wind up not going through the bad debt process. So by properly structuring a TPL process, more accident accounts are identified and properly billed, which decrease your denials and allow an opportunity to maximize on collections for this book of inventory, increasing your cash that otherwise could have gone unnoticed. And with these, clicker here, I think there may be a little delay, sorry. And as Justin mentioned, looking at the different types of coverages that you run into in looking at these. When you look at accident-related accounts, there can be multiple available payers, and each one has a different impact in your timing and in your collections. So it's important to recognize the nuances and understand the difference in these different payers to be able to maximize that TPL process. MedPay and PIP, or as you may hear it recalled as personal injury protection, those are considered your first party coverages, and that usually means that those are primary and typically your first paying payers. That coverage is created to offer quick financial assistance to injured patients and help them recover their medical bills, but it can also go toward lost wages, household services for those accident victims. And this is the patient or the driver or owner's insurance, and that covers the car in which someone is riding in. So it pays regardless of if the insured was at fault or not. MedPay coverage is not required on your insurance plan and does have limited policy limits. We typically see those being much lower paying limits of $1,000 to $5,000, which means that it exhausts quickly. This is why it's vital to identify those coverages and bill those early before those benefits exhaust. Payments are also usually directed by the patient. So for most states, any available coverage, then those liens may not be applicable to those if there's a filed hospital lien. With PIP, it is first party, but it does differ slightly from your traditional MedPay coverage, as most states, such as Utah is an example of one, most states do not require it, but Utah, being a PIP state, does require mandatory PIP coverage on your insurance policy, and it is always treated as primary coverage. In addition to that first party, some patients may also have liability coverage if another party was found at fault for the accident. And this coverage is determined by fault and is required by state law to carry any of those minimum coverages to help with the medical expenses of an accident victim injured if it's due to the fault of another person. So although this coverage is usually more than your first party coverages, there still are policy limits that come into play. Typically, you have minimum limits of those of $25,000 to $50,000 is usually what we see. and those minimums are set by each state. And so, unfortunately, we also see too often that the medical costs due to accidents for many patients that have significant injuries, that typically those medical bills may be greater than those amounts of policy limit coverages available. And so, for too many of those instances, we also find the at-fault driver may not have any coverage at all, even if required by law. So therefore, a patient may also have an underinsured or uninsured motorist coverage that could be available to pay, which can be added by a patient's own policy to protect them in the instances of other drivers for those situations where there's just too little coverage available or no coverage at all to help them to cover the damages that they have incurred due to an accident. When we talk about PIP, this is also maybe called no fault. So each state is either considered an at-fault or a no-fault state, depending on their legislature's determination of insurance law. The majority of states we see are considered at-fault states, in which determination of fault is made in each accident that occurs involving multiple parties, and that party is deemed responsible for making the other party whole. As this can often be disputed as to the fault, the measure of each particular party's fault, as well as the damages that are incurred, these matters may be litigated, and that often prolongs these settlements. That delay can be caused for many states, can be caused for many reasons, because in some states there's a statute of limitations as to when the patient's even required to file a complaint. And they usually have at least up to a year, sometimes up to 3 years, before they're even required by law to file a complaint to pursue on those damages, in which allows more time that it may take for it to be prolonged. And even when those cases, once litigation may be filed, those cases can continue to drag out as they go through the discovery process and those motions before the case is ever tried and ruled upon if there's no settlement prior. There are a few states, such as we mentioned, such as Utah, that are considered no fault or PIP states, in which the legislature looks to reduce the amount of that litigation and the timing and the discovery that is required to determine that fault, and just have each party pay their own medical expenses regardless of the fault. For no fault states, most usually have higher PIP limits to cover those injuries, and they may also require a higher standard of fault be assumed before they require that a party make amends for each of those in those situations. And here you can see in a breakdown of those, as I know we've kind of talked about a lot of different coverages, policy limits, fault, no fault. And so that can be very complex, especially when, as in today, I know we're speaking to multiple states here. And so we did want to just kind of share at a high level a breakdown of the relevant applications for you and looking at some of those items. And so one item that we've not really discussed here yet is the hospital lien, in which there's also an additional tool that's available to states to allow a hospital to collect on their damages for those charges. But like any other items, those we talk about with the hospital liens, those are also created by state statute and therefore also differ from state to state in how those are applied. And so here we're just sharing a brief overview that you can see of the type of state, the minimum limits, and any of the different statutes that apply here. And as you can see in the other states here, it was too many to get on one list for today. But as you can see, also represented with the hospital lien information, that most states do have a statutory lien law. There are only 9 states that do not, with Wyoming being one of those. And for those lien states, there are very specific requirements to be able to perfect that lien and preserve the right of the hospital to be able to use that action. And you can see that most states with the hospital lien law do require the actual filing of a document for there to be a public record of that. There are some states, such as Montana is one of those, that is considered a notice-only state, in which notices are only required to be sent to those known parties. But the varying state laws do determine who qualifies to be able to create the lien, as well as what coverages are applicable within those. And so the next step, of course, as we've mentioned here about the liens, is exactly then what is a hospital lien? And with this talk of the word lien, we know that that can sometimes cause concerns and may have even negative connotations. And so many may ask, well, what is that? How does that look? What is used by that? So if you utilize this tool of filing and applying a hospital lien, it is very important to be able to understand what that claim means and especially what it is not, because there are many misconceptions on that. So as we mentioned, the lien laws allow a specific statutory right. And that right is just a right. And it's an applicable tool, but it's not a requirement. And so for some states that have been able to allow that through their legislature, they allow hospitals to utilize this to apply much like a creditor would against a patient's settlement, judgment, or compromise. And legislatures recognize that hospitals often are treating patients with no means of recovery. And so it allows the hospitals to assert a right of payment against these potential means if the patients are being paid due to those injuries. And it helps the hospitals protect themselves to be able to recover some of those costs for services rendered to help make sure that they're not creating a windfall for patients who may otherwise pocket the money and not reimburse the hospital for those expenses. And each statute differs. It has its own unique requirements and what's required to be able to create a lien. And that's why it's vital to understand the legalities of each one of those. There are some misunderstandings on what a lien does not apply to, as many argue liens are diminishing wages or stopping the sale of a property. But hospital liens, and against all state statutory hospital liens, are solely used against a particular settlement due to those injuries incurred. They're not against any patient directly, nor do they attach to anything of the patient's, and especially not if there's a workers' compensation that may be involved. Those would all be primary. So it's very important to understand and be able to explain this. And teams often do a lot of educating on this matter to patients because they can certainly be very sensitive to the word lien. So it's very good to know not only about the liens, but also that it's just one tool that is available to be used for hospitals, but it still allows the hospital all of the rights in their collection measures, that it's not the sole thing that they have to use, as there are many other opportunities as well. And so when you look at the process, what are some of those best practices to be able to recommend in making sure you have the greatest impact and also the smoothest processes? To maximize your revenue, it is imperative to have thorough discovery with any TPL processes so that you're identifying what occurred, why the patient was treated, and you understand all the potential payers that may come into play. In addition to quickly billing those payers that are identified, liens are recommended if verified and applicable so that the hospital can use that to protect its interest for payment. But not only does one need to look at all the available auto insurances, but also, of course, looking at any health or governmental payers that may be available. These contracts and regulations dictate the priority of the payers as well as the timely billing of each one. And this must be reviewed and coordinated properly so that you can ensure no timely filings are missed and all processes are compliant with the relevant laws. One also cannot just expect to bill the payer and sit back and just wait on the payment to come in. It is vital in having a good practice to be able to have efficient follow-up, to be able to track the claims with the insurance adjusters handling and processing the claims, as well as any attorneys who may be representing the patients, to ensure that these bills are being recognized and the statutes are protected with those liens. And all payments should be reviewed so that you can confirm if those payments that are being made are correct so that you're maximizing that reimbursement. Those have to be reviewed as to the payer that issued the payment, along with any denials that may be received, to be reviewed for the reason for denial, to be able to perform any appeals, as well as the timely response on those and enforce the correct payment. A good process also quickly identifies any of those impairments. of the liens in which the patient is paid directly by the insurance, avoiding the lien. And the provider's lien is overlooked in those situations. And so actions to have to be able to enforce a lien usually have a statute of limitations, which differs again from state to state, which is why it's important to timely review those and to see who is held accountable, and requires an experienced team to be able to review and remedy any impairment quickly. A TPL process typically does require patient cooperation, and it's very important early on in the process. And as we talked about previously in how liens can sometimes sound and be concerning to those patients, especially their elderly group of patients that may not understand this process and what this means, as they are required to receive these notices in the mail. We all recognize how important patient satisfaction is to our revenue cycle. And so an ideal process takes all of this into consideration to ensure that you're taking a patient-friendly approach as well on the front end, and very early on educating patients in what these processes are. And as we start here in that discovery process, as we mentioned, a vital part of the TPL process is the discovery on the front end. So a strong investigation process does ensure that all potential accident-related accounts are identified quickly and that they're vetted to identify all of the viable coverages. And here's some items to support those practices. Working with your staff on the front end so they understand the importance of early identification at the time of treatment. The faster that it's identified and claims can be verified and billed, the quicker you're able to get in there before some of those first party benefits exhaust. However, we also recognize some accident-related treatment. They may be follow-ups, scans coming in, or it may be a follow-up treatment, and it doesn't always present as accident-related on the front end. So it's also important to review accounts after treatment as well. And when your staff receives requests for bills and medical records, they should also be reviewing to ensure that these accounts are currently being followed up as your TPL accounts. This does require patient cooperation. So to maximize your patient interaction, an omni-channel platform does work best, which we will mention further, in allowing patients multiple ways to be able to utilize also over a wider span of time for them to be able to respond and give feedback and share their information. A TPL program is only as good as the identification of those viable claims. So that discovery of all available claims out there does require multiple avenues of searching for these claims and not solely relying upon this patient cooperation in order to maximize your cash that you receive on this collection of your inventory.
Yeah, see, when we go into a new client, I'd like to get your feedback. I think in my mind, when we go into a new client, the discovery process is probably the number one area that we identify an issue, right? There's probably others, but I think the discovery process is the most complicated area in this space, is like discovering the information. And just if you could talk about that just a little bit, like when you go into a new client, is that the area where we find the most benefit for us coming in new, or what do you think is the most beneficial for a program like ours?
I would say so, in making sure that, again, you're maximizing that net. Because if there are accounts that are being missed and left out, then that's the missed opportunity of that missed revenue. So it's vital to be able to include multiple ways of looking at the inventory and really looking at who's coming in, what are your reasons for treatment, what you're seeing there, looking at all those payers, and doing that in multiple ways over a multiple way, and and having a regular review of that process too. I think in looking at trends that you see, and whether internal or outsourcing, that you're looking upon the trends for these as well, because then if you start to see trends falling off in your volumes, you can look back to see a root cause as to, has something changed in our process? Are we missing these somewhere? And so those are always important to, as you even continue in the project, to ensure that there haven't been changes or something missed. Maybe it's registration. We all recognize that registration is one of the areas in which you have high turnover in your employees. And so, again, always following up, always doing that re-education to ensure all steps of the process are being managed and working effectively.
Yeah, good. Thank you.
Absolutely. And here's we talked about also, I know I mentioned kind of that omni-channel approach and that patient communication. As times change, we all recognize that we kind of have to change as well and continue to review our models and processes to keep up with the changing audience that we're looking to. And in recognizing a large part of TPL is that first hurdle of patient cooperation to even understand why the patient was treated. Is there insurance available? We understand that in today's times, most patients, they're just not very responsive to phone calls. They're also leery of who may be contacting them. So data shows us that the majority age groups prefer text and email as their preferred mode of communication. And for the best success, as you can see, multiple communications is what they are looking to see and is what they are most responsive to. And here, further data will show that an omnichannel strategy helps to improve that patient responsiveness to identify more claim information faster than traditional methods alone, which require we communicate with patients in the manner that they prefer. Digital communication preferences are becoming industry standard for auto insurance, health insurance, and now we're also seeing it for the revenue cycle. But patients still prefer to be able to choose that way in which they communicate with payers and providers. In a March 2025 study, Insurity reported that 48% of the respondents preferred a digital only on an if needed basis. And that concluded the importance of a hybrid engagement strategy combined with the efficiency and flexibility being offered to the patients on that. With also brand recognition being very important, ensuring patients up front that they are working with a trusted partner. Patients are 89% more likely to interact when they see that it is a branded, trusted sender. And with this increased engagement, you're able to increase the net inventory that is being billed, identifying more payers, and then, of course, with that, being able to accelerate your cash. We have mentioned compliance multiple times today, as that is a large part of managing your TPL process. It's important to be successful that strict compliance is met, and that requires all available insurances are reviewed and tracked, both your auto, your health, your government payers. Each payer has unique timely guidelines, and so you have to make sure you have an efficient and effective system that is requiring you to ensure all of those are reviewed and that they're also fail-safes within that process to confirm that you also have a proper billing occurring. If liens are applicable, then that's another area of compliance to ensure that those are being properly filed, perfected, as well as being timely released in accordance with all of the state statutory requirements. And if there's an overlap with multiple payers being involved, then you may also be receiving multiple payments, and that occurs creating overpayments sometimes. So it's imperative that you have someone with an experience and working knowledge of your compliance with the priority of those payments, and they're reviewing those payments to determine how to handle those situations appropriately so that they know who to refund and or appropriately rebill whenever they're working through those overpayments situations. Whenever you're reviewing your current TPL processes, or you may just be looking to update those processes, there are a couple of factors to be able to consider to ensure that you are creating or following best practices. And that stands for either if you're managing it internally or if you're choosing to outsource it, or if you're thinking of outsourcing it and looking for a vendor to handle those. So here are a couple of items to help you to consider in your review how these processes can differ and what those different options may be providing you. TPL is very specialized, and so it does require specialized processes that most systems do not have built into them or have the technology available to be able to effectively work those and track those, because there's multiple items that do have to be tracked through the investigation process, through the billing, ensuring all those metrics are met, ensuring the timeliness. And so most of these items are not built in just your regular billing processes and your regular billing systems. Typically, this is more specialized, and so you can have more efficiency for those with more expertly created technology to be able to track those that are specifically built for those purposes. If you do outsource, providers are able with that to be able to reutilize that staff. We know that everyone's always being pushed. There's always more work being pushed down. So there's always an opportunity for reallocation of staff to be able to help in other areas, to help shore those up, give stronger abilities there, and to be able to outsource it and allow a cost reduction of any of that staffing for particular areas. With outsourcing, that does ensure that you have true experience on these claims. Any partner or vendor that you're looking for should be able to bring a specialized experience, as there are several, complexities involved. As we've mentioned, everything from ensuring that thorough discovery to the complete billing, a lot of the very specialized follow-up, especially when you are working with attorneys' offices. Those are typically the most challenging, in that they are citing case law, they're coming back, they're demanding releases, they're demanding reductions, and sometimes regular billing staff are just not familiar with the different statutes or case law that may be presented, or exactly how to apply those liens and what the hospital has a right to. And so it does give you an opportunity to partner with other vendors who have more specialized expertise within those areas to ensure that you're effectively getting the best return possible for these identified TPL accounts. As well as keeping compliant, there are also many items to ensure strict compliance, which does usually require, again, that experienced, knowledgeable team, and having to coordinate all of those different sources. And things really do change. There really is, again, looking at each individual unique account on the set of circumstances as far as which payers are available, how all of those payers come into play, what the timely filings look like, what your contracts require, all of the different regulations. So in order to be able to have someone who is truly specialized within that and understands those, to make sure that you're not receiving any denials and having to write off any inventory, or find yourself not being compliant with regulations. And if you do partner with the vendor, you'll find that most contracts do work based on a contingency fee. And that fee, of course, is only paid on what is covered. So oftentimes some staff may be reluctant to send it to a vendor because they feel like each placement is a cost. But typically with contracts, those fees are based solely on what may be recovered from those TPL payers. And so this really eliminates any investment cost, and that you're solely typically only paying for recovery on those where that TPL is identified and billed and recovered. So much of that inventory may be looked at and reviewed and may have a different payer, and you're not being out at any cost unless your partner actually recovers for you within those. We do daily hear about security concerns and breaches. So it is important, as a part of your daily working model, that is another component in reviewing, especially in outsourcing, is that you do need to feel confident that whomever you do partner with, you have a vendor who employs a very strong security features that and processes that are regularly tested and reviewed, and that they are regularly meeting all of those legal requirements as they go through the different processes. And so now we will open the floor for any questions. I don't believe that any came in throughout as we were sharing the slides, but we welcome any questions for anyone.
There is a question that just came in. Douglas writes, is it ever appropriate to bill the patient while waiting for a settlement? It's a good question.
So I would say, that could be a little tricky because you do want to be aware of your time constraints. And so, yes, typically, if you are waiting for a settlement, I would say, in which part of the settlement are you waiting for? Are you just waiting for the patient to settle, or they've settled and you're waiting on that? You've worked out a settlement with the patient to be paid out. So I guess I would just make sure I'm looking at the correct definition of when you're waiting for the settlement. So if you're waiting for the settlement in that you're actually waiting for the patient to settle their claim with the insurance carrier, I would say that in that case, you can definitely bill the patient. There's no problem. There's nothing that requires, and again, that's why I'm always want to be quick when we're talking about lien, non-lien. I know sometimes even in non-lien states, providers may say, well, we're not able to have a lien in our state. So therefore, there's nothing TPL can do for me. I just send that on to the next payer. And that's where I always try to call out that the lien even itself is only one tool in a provider's whole capabilities of being able to utilize to recover on these. So we would recommend that it's okay as long as there's no other insurances. So obviously, if there's some other type of health insurance coverage, such as a Medicare or a Medicaid in those situations, that you're not in those situations billing the patient directly. But if your billing system allows you the capability of sending bills out to the patient on your self-pay inventory, even if you have filed a lien in those situations, which again, the lien is only against the settlement, in those situations, I would think it would be a very useful tool to be able to bill the patient while you are also going through and billing any of the auto insurances or at fault carriers. And those situations, as a reminder alone to the patient, hey, you're responsible for that bill, because I think that also prompts the patient with what leverage they have to be able to settle the claim, and they don't forget, hey, I'm still responsible for this bill out here. Now, obviously, if you do have a Medicare or Medicaid, we don't want to bill them directly, but if they're still waiting and this process is still going on, if you have the capability of sending a bill out to the patient, we would recommend that. Unfortunately, I think a lot of billing systems don't allow it to do that consecutively, that they're doing those together. But if that is able, I think that you can. At the point that you've reached a settlement with the patient and you're just waiting on them to issue payment, again, I don't think that there's a problem. It's a reminder of letting them know that, hey, this bill's still out here. We're still waiting on payment, because it is something, as long, again, as it's a self-pay patient, ultimately the patient is still responsible. They still have the duty to pay that bill, whether they're paying it out of that settlement or not directly.
Yeah, I think that's a comprehensive answer, Cassie. The only thing that I would add to that is we've seen complications in the past when we see a self-pay discount added to a billing that's going out to a patient. And so that's the only caveat there is, I think it's fair to bill a patient. It helps us, those of us that are working the TPL account. I think it's the right thing to do, letting the patient know, yes, this balance is going to be yours if you don't get this settled, right? But the only thing that I would add to that is just be careful with the self-pay discounts that might get added to an invoice going out to a patient.
And another I would add on to that as well, because it is, and just as Justin said, that we do want to be very cautious of those adjustments being added. You also want to be cautious of if an adjustment goes on and you have to remove that adjustment, that's technically okay. But if the patient has already received a bill with that adjustment, that can present a bad policy and be very difficult to explain and try to then bill full charges. And also, if you have aged inventory that is continuing with those, you would also just want to make sure you don't want these to go into your bad debtor collections and have a lien and trying to pursue it, as well as having it within some type of bad debt. That can also create another circumstance in which you want to be mindful of that.
Douglas, great question. Are there any other questions out there?
So I think, Doug, is that your follow-up question there? I think you're saying could be very high dollars if billed to the patient will eventually go to collections, may take years to settle. 2 years for the state of Idaho does seem unfair to the patient who is waiting for a settlement. And again, that's where all of those kind of need to be watched in tandem as far as that statutory limitations, and so that you're watching those. And typically, I think you do have some avenues to continue, and I don't think you necessarily do have to bill the patient at that time, but that is something to make sure that you're staying compliant in those. Again, as we said, you don't want to make sure that it ages too much, but I think that in most situations, there are ways to work around those. Because again, in those situations, you're typically billing or enforcing any liens against that settlement itself and not the patient. So I think you usually have some different caveats for this.
If there are no other questions, I guess we may as well wrap it up, right, Cassie?
I think so.
Appreciate everyone attending today. Thank you for listening in. If you have
I think someone may have a hand raised.
Okay.
Is that Kelly? Is there a question? I'm not seeing the hand anymore.
Great. Thank you all for your time. We will circulate this PowerPoint. Yeah, we'll circulate the PowerPoint at the in the next couple of days. And if you have any questions, please feel free to reach out.
Thank you, everyone. We appreciate your time this afternoon. Have a great day.